Hello, everyone. My name is Samantha Shockley, and I will be talking about postpartum depression today. I am here on behalf of Postpartum Support International. It is a non-profit leading organization dedicated for expert-led resources, support, and education for individuals and families dealing with perinatal mood and anxiety disorders like postpartum depression. I currently hold a Bachelor's of Health Education at Georgia Highlands, and I'm currently in the midst of getting my Certified Health Education Specialist certificate at Georgia Highlands. I am teaching this class in hopes of educating postpartum mothers and their families about the causes, effects, and symptoms, how to get support, and local resources for postpartum depression. My goal by the end of this lesson is to be able to educate postpartum women and their loved ones around the ages of 25 to 35 in Fulton County about postpartum depression. My first objective, by the end of the lesson, at least 80% of participants will be able to identify a minimum of 3 symptoms of postpartum depression. Objective 2, at least 75% of participants will be able to list 3 personal support pillars for the postpartum plan. For example, professional contact, physical self-care habit, and boundary. So let's get connected for a minute before we dive into definitions. So we're going to pair up with someone in the room you don't really know well. We're going to find a connection by sharing a brief insight to postpartum depression, whether it's personal or through a loved one you have recently experienced this with. Please only share what you feel comfortable disclosing. We are here to support each other, not put anyone on the spot. So what exactly is postpartum depression? PPD is a complex mix of physical, emotional, and behavioral changes that happen after giving birth. It is a serious but treatable medical illness. There is a common reference known as the baby blues. However, that does typically resolve within the 2 weeks. After giving birth, PPD symptoms are way more severe, persist longer, and can significantly interfere with daily life, self-care, and bonding with the baby. A quote from American College of Obstetricians and Gynecologists says, "PPD is a medical condition, not a character flaw. It is not caused by a lack of willpower. You are not alone, and it is common and treatable." So, the big idea is that PPD arrives from interconnected factors such as biological, psychological, and evolutionary factors. Biological. There's drastic drops in estradiol and progesterone. Those are estrogen levels in women, which help regulate menstrual cycles, pregnancy, things like that. Which causes possible HPA axis dysregulation, which is just a mood drop where you're not really wanting to do what you usually want to do. You're irritable, you're all over the place. It just affects your mood. Now, psychological. There's intense transition to new parenthood, especially with new time mothers. However, it can happen with second time, third time, etc. And also the physical toll of childbirth, which is a major stressor, like tearing, the intense pain, labor, things like that do play in psychological stressor. Evolutionary. Now, there's this controversial quote-unquote mismatch hypothesis where modern culture shifts may worsen risk of postpartum depression. This means back in the day, the woman had more family help and interconnectedness with extended family and friends. Moms having to work more, not being able to breastfeed, not having the family ties, having to be away from family. This causes risk in today's world. That's where the mismatch hypothesis comes from. And then the medical and history. So, for example, if the family history has mood disorders like bipolar disorder, OCD, that can heavily affect pregnancy and the postpartum depression risk. Now, knowing the why helps, but recognizing the signs is what gets people support sooner. So, how do we recognize the symptoms? Emotional signs: persistent feelings of sadness or emptiness, intense irritability or anger, withdrawal from family and friends, And then the physical signs would have to do with excessive crying, unexplained recurrent headaches, chronic stomach problems, decreasing appetite, things of this sort. Important to note, PPD does not present as increased energy or overwhelming joy, according to the Diagnostic and Statistical Manual of Mental Disorders. Now, let's take a deeper look into the symptoms. Unlike baby blues, PPD manifests in severe, persistent ways across four domains. First one, emotional. Feelings of hopelessness, shame, worthlessness, and severe guilt. Mothers often experience a total loss of joy or pleasure in things they previously enjoyed, coupled with intense irritability, not wanting to go on walks, not wanting to do their normal hobby like walking. I just said that. Second one is behavioral, withdrawing completely from family, friends, and support systems, experiencing unexplainable crying spells, and in severe cases, might have terrifying thoughts of harming oneself or the baby, but that is in extreme cases, which is extremely rare. Physical, severe disruption of biological rhythms, including the inability to sleep, even when the baby is sleeping, which is called insomnia. Profound sluggishness and a drastic change in eating habit, eating significantly more or less, or not eating at all, just completely cutting out the appetite, which is not good at all. Cognitive and relational. You have difficulty bonding or feeling connected to the baby, even with partners and family, friends of the sort. Feeling as though you are not the mother can co-occur with severe anxiety, intrusive thoughts, or obsessive compulsive disorder traits. Constantly checking on the baby, disregarding your own health, things like that. Now, if you've ever had scary thoughts, that's a sign to get help, not a reason for shame. So don't worry if there's support out there. PPD risk is shaped by systems, not just individuals. So we're going to jump into the socioeconomical factors. Neighborhood. Living in socioeconomically disadvantaged neighborhoods significantly increases the risk of postpartum depression. Higher deprivation scores directly correlate with worse postpartum mental health outcomes across populations. This jumps into race and ethnicity. PPD affects individuals differently. However, a study from JAMA Network Open says that Black mothers face a disproportionately higher risk. Over the last 5 years, there has been a 30% increase. This risk further escalates as a neighborhood disadvantage increases. So, low income, low food security, access to healthcare, things like that do drive the risk up in disadvantaged neighborhoods. Why it matters. These disparities highlight the need for targeted public health and equitable care. There's no blame, but there needs to be things done like support systems that prioritize disadvantaged communities to ensure care is meant for all mothers and babies. A study from Agnifer, the BMC Psychiatry article, 23% of young mothers actually reported PPD symptoms, which means they're more than twice as likely to develop symptoms. Only 11.6% of older mothers above 21 reported PPD symptoms, which they just served the baseline comparison to the group. And then, surprisingly, I found that single mothers were not found to be at an increased risk for PPD when sociodemographic factors were controlled for. However, the underlying factors are driven heavily by systemic stressors rather than age or single status alone. For example, educational disruption like school dropout, not finishing your degree, and parental unemployment, just not being able to get a job, unstable income, were found to be the most influential factors for predicting PPD symptoms. So the timelines and impact. Yes, you can have postpartum depression during pregnancy, but it is usually supposed to be after birth, which coincides with the word post, the prefix post. However, people do experience symptoms, starting to emerge during pregnancy. However, the core onset window is usually between the birth date, and the first birthday of the kid, of the baby. However, if it's left untreated It can cause difficulty concentrating, making decisions, and can severely impact daily functioning and baby bonding. Early recognition is vital, according to the World Health Organization. It is treatable. It is not, you'll be fine. It is treatable. So this can lead to, again, impact on infant development and attachment. Untreated PPD can significantly ripple into the child's early developmental stages. For example, attachment and bonding. Difficulty recognizing or responding to infant cues can lead to insecure or disorganized attachment, weakening the foundational mother-infant bond. Socio-emotional risk. Infants may exhibit increased emotional dysregulation, excessive crying, and face a higher risk of developing behavioral problems in early childhood. The cognitive and physical can result in delays in language acquisition and cognitive milestones, as well as disruptions to healthy sleep and feeding routines. Support changes the outcome. Even though these are all negative things that can impact the infant, support can change these outcomes, according to the Cure Census report. Now, let's just all take a breath and relax. If this is overwhelming, if you feel discouraged, it is okay. We'll jump right into the prevention and how loved ones can help. Let's shift to what can help, starting with prevention. So, proactive prevention strategies. Establishing lifestyle habits and support systems can early significantly mitigate risk. First, prenatal education, like I am doing right now. Discussing PPD risk with doctors and family before birth sets clear expectations. It is not too much to ask too many questions. 2, social support. Building a community network to share the practical burdens of early parenthood. For example, the Postpartum Support International Georgia chapter does dedicate expert-led sources if you need social support. 3, physical care. Prioritizing maternal sleep and adequate nutrition stabilizes biological rhythms. Having a set sleep schedule when you put the baby down, when you feed them, and being able to adjust and assist with your diet. If you need to cut back on something, if you need more of something, adjust to that. If you need vitamins, there's good things out there for like prenatals, vitamin A, vitamin B, vitamin C, vitamin D, all of the good ones. You can take vitamins to supplement if you can't get the right nutrients in through food. 4, boundaries. Setting strict limits on visitors and non-essential tasks to protect the mother's energy. If you make a plan and you don't feel like going out, it is okay to cancel. It is totally fine. It is about you and your health. 5, routine checks. Committing to early postpartum checkups and completing EPDS screenings honestly. So if you feel like something is going wrong, if you feel uneasy, it is okay to plan a postpartum checkup. They already have them set out for a period of time, but you can set more if you feel, you can set less if you feel. EPDS screenings are the Edinburgh Postnatal Depression Scale. It is a 10 questionnaire over a 7-day period of your postpartum journey. So at the end of your 7-day period, you would take this and it would see if you had gotten better with the PPD symptoms or worse with the PPD symptoms. If you need to evaluate more on with your provider, it would suggest that you would do that, which is a great resource. It is used globally. Now, ways to cope and find comfort. Professional help. I cannot stress this enough. Seek support through therapy or counseling. Professionals provide safe, structured healing. They provide the best educational outcomes with postpartum depression. They have the best feedback. Obviously, they know what they're doing. They're paid to do this. So go to them as much as you need to. Self-care basics. Prioritize sleep, nutrition, and gentle movement. You can't emotionally recover if you can't physically recover first. So having a sleep schedule time, eating the right nutrients, taking the right supplements, vitamins. All of those play into being able to mentally recover as well. And then open communication. Do not hide your feelings to prevent burdening others. Honesty is the crucial first step. That is how you're going to get the best outcome. You have to be honest, professionally and personally, with your friends and family. Reach out. It is not a burden. How loved ones can help. Now, everyone in this audience who is not the mother, like partners, friends, family, mothers, fathers, etc., this is how you can help. Be a practical support. If you can, if you're able, help with household tasks, and if comfortable with the mom, baby care. She needs to go out for an hour, take care of the baby, be able to know what you're doing with the baby. Reducing physical stress allows emotional recovery. This is probably one of the best ways a mom can emotionally recover, is having time to herself, to regenerate, to be there for her infant. Emotional support. This is a very big one. Listen actively without judgment. Sometimes just simply being present is the most powerful support. You don't always have to have a solution. Just be there and listen and comfort. Be the person to lean on. Now, what to avoid. Do not minimize their feelings by saying it's just hormones or telling them to snap out of it. It is not just hormones. It is a medical disorder that needs to be treated professionally, and you need to be there for them. You don't need to be saying things like it's just hormones or snap out of it. It is an emotional burden if the mother cannot feel like they can rely on you. So please be careful of what you say. Be mindful. Now let's build a simple plan with 3 pillars. Here is a pyramid. So we're going to start at the very top. Professional contact, either a therapist, doctor, or local support group. The middle one, personal boundaries, setting a limit to protect your peace, like limiting visitors, having time to yourself. And 3, physical habit. A dedicated self-care action like a daily walk or resting is always recommended, according to the Postpartum Support International Georgia chapter. As I read these, I want you to mentally pick one for yourself. You'll need it for the end of this lesson. Now, early detection is critical for effective management. So the screening and diagnosis comes with the self-care, the self-assessment tool. The Edinburgh Postnatal Depression Scale tool is the most used self-assessment tool, like I've said before. It is very easy. It can help you evaluate if you need to see a professional or if you're doing well, tracking your progress. 2, a clinical assessment. Formal diagnosis relies on detailed clinical evaluation and openly discussing symptoms with a provider, according to the Office on Women's Health. Tell them everything. It doesn't matter, the nitty-gritty. That's how they get the most effective diagnosis for you. 3, when do you think you should screen? So the American College of Obstetricians and Gynecologists says screening during pregnancy is vital and at comprehensive postpartum visits to catch symptoms early. So if you feel like there's something wrong, there's no harm in asking them if you can be screened for postpartum depression. It's always welcomed if you feel like you feel uneasy about something. But let me say one thing. Screening is informational. It is not a label. So it is just a helpful tool. You're not being labeled. It's okay to ask for screening. A combination of therapies and medication offers the highest success rate for clinical treatment options. Now there's 3 main ones, and I'm going to tell you why each one is important. Or you can vice versa. Throw one out if you don't really like it. Throw one in if it's the best for you. So according to the Office on Women's Health, psychological therapies like cognitive behavioral therapy and interpersonal therapy are highly preferred and effective for addressing stress. So this is not having medications or treatments put into your body. This is basically just talking to a licensed counselor or a therapist who is advanced, who is an advanced specialist in postpartum depression. Probably the best way to go if you think you have something that's not going to be just talked about and you need to be treated medically. This would be for the oral medication postpartum mothers. Antidepressants like SSRIs and SNRIs, which are just mood inhibitors, they give you a boost of serotonin. So like sertraline is used for anxiety and depression. These can be effective for managing acute symptoms. They don't take away the entire postpartum depression, but they do help alleviate some of the stress and anxiety that comes with postpartum depression. Now, more expensive and elongating treatment would have to be this innovative treatment called brexanolone. It is basically where they hook you up to an infusion for over a 60-minute course, and you go every other 2 weeks. And it has very strong intravenous synthetic mood stabilizers. It has been shown to cause a rapid decline in severe PPD symptoms. So this is probably the strongest treatment, but it's also it's inaccessible to a lot of healthcare and insurance companies, so it is kind of hard to get, but it is there. You can always ask your provider if you feel like the symptoms are way too much for you and you think you're not getting anywhere with the other two. Now, some local resources that help with maternal wellness are NAMI Rome, which is the National Alliance Mental Illness. They operate locally out of Central Plaza in Rome, Georgia, and they offer free community support groups, journey programs, and mental health advocacy specifically designed to support local families. Then on the right side, we have Georgia Hope and PSI, which is what I'm a part of today. It is a regional perinatal mental health resource where they connect Rome mothers with trained coordinators, ensuring access to professional counseling and peer support. A lot of this has to do with virtual appointments with counselors and things like that. So if you feel like transportation is a disadvantage for you, that is a great opportunity. You can always do this online. You can sign up. It's easy. You don't have to pay anything. And then the most well-known one would have to be the Atrium Health Floyd Behavioral Health. They offer a maternal wellness program, and it dedicates to psychiatric evaluations, individual counseling, and medication management tailored to postpartum mothers. I did personally go to a behavioral health therapy session, and they did great. I think it is a great way to be able to connect with your local providers, especially the ones in Rome. They have very many sections to maternal wellness. They even have education classes at the Atrium Health Floyd Education Center, which is right across the hospital. So I feel like if you were interested in that, that would be a great opportunity for you to learn more things outside of the realm. Now we're going to do a quick activity just so get loosened up, take a breather, get to know one another. So it's called the Postpartum Grab Game. We're going to reflect and share. Everyone will get a chance to participate in this group activity. So what you're going to do is you're going to draw an item from this bag up here, like a baby bottle or a diaper, like share your name and your baby's name. If comfortable, you don't have to. And then you're going to share a self-care action you plan to take care for yourself. So, yes, I'll give you about 10 minutes for that. And then we're going to jump to a knowledge check. So let's jump right to this knowledge check. Is postpartum depression caused by a lack of willpower? False. It is a medical condition. It's treatable. It's common. It is not a character flaw. Do hormonal fluctuations play a role in postpartum depression? Yes. For example, severe drops in hormones occur with estrogen, being irritable, angry, sad. It's all part of postpartum. Can loved ones help by taking on baby care and household tasks? Yes. Reducing physical stress is vital for a mother's healing and her mental recovery. My references. I wanted to thank everyone for coming today. If there's any final questions, comments, or concerns, feel free to come talk to me after the plan, or If you want to email me, I'll put my email down here. But remember your self-care plan and know that support is always available. I will be handing out a self-care plan outline for you to complete just so you would have an idea. And I hope everyone got a little bit of education on postpartum and how to educate others. Thank you.